What's the first week of anesthesia residency like? What are the highlights, challenges, what sorts of cases do you do? In this video, I'm going to tell you all about it. What's up, everybody? My name's Max Feinstein and I'm an anesthesia resident at the Mount Sinai Hospital in New York City. I just finished my first week of CA 1 year, and I actually would have done a month of anesthesia during my intern year, except COVID happened. So this is actually the first time that I've been doing anesthesia since I was a fourth year medical student doing away rotations. In this video, I'm going to share with you an overview of what sort of cases I did, what the highlights of the week were, some of the challenges, and then also what I've been studying and how I've been studying it. You can either jump to the sections below using the chapter headings, or you can just watch all the way through. If you enjoyed this video, I'd really appreciate it if you like it below and also subscribe to the channel. In terms of the cases that I did this week, everything was very straightforward from an anesthesia perspective. So patients were really healthy, so that would be ASA 1s and 2s using the stratification system from the American Society of Anesthesiologists. And also the cases were very straightforward from a surgical standpoint, so a lot of abdominal cases, cholecystectomies, hernia repairs, but there were also a couple other different types of cases mixed in, like thyroidectomy, parathyroidectomy, and one of the thyroidectomies was actually transoral, which meant that we had to do a nasal intubation, so I did a fiber optic nasal intubation, which was really sweet. And then most of these cases were with adults, although I did have one pediatric patient, but for the most part, all of the peds cases are just saved for a pediatric specific rotation because there are such unique anesthetic considerations for that it's its own subspecialty. In terms of highlights, one of the biggest things that stuck out to me compared to the internal medicine rotation I just came off of was the significant lack of note writing that resembled novel authorship. In fact, I can actually see off in the corner of this room that it looks like there's a current medicine intern who's in the middle of a really lengthy H&P. Looks like he's getting onto his 7th, maybe 8th paragraph, and I was picking up the phone. He looks distressed. I wonder what could be... Oh, it looks like his patient just eloped after he spent an hour and a half writing the H&P. You hate to see it. By contrast, anesthesia note writing is lightning fast. In fact, in having just spoken this sentence, an anesthesia resident down the hall just finished 7 notes. It's been said that a senior anesthesia resident can write notes faster than the human eye can actually see. I wanted to see this for myself, so I actually went out and I found some very rare footage of an anesthesia senior resident writing notes, and it's been digitally slowed down so you can actually catch him starting and finishing notes. It's really incredible. So besides not missing note writing, one of the things that's been a huge highlight here is I have way more autonomy compared to when I was an intern. The starting point for that autonomy is actually the night before a case occurs, because I'll look up a patient, see what the surgical plan is, and then I get in touch with my anesthesia preceptor and talk about what I would like to do. And so really the question is what anesthetic plan I would like to use for this case. To give you an example of something that I think about, yesterday I had a case that was a robotic hernia repair, and since they're going to be using insufflation, I thought it'd be important to paralyze the patient, which means that we have to do general anesthesia and we have to insert an endotracheal tube, versus another case that I had yesterday, which was an open hernia repair, which didn't require paralysis, so we were able to do it under max sedation. And that's all just before we start the case. So then once I actually get into the operating room, my anesthesia preceptor will ask me what induction medications I'd like to use, what dose I'd like to use, what I'd like to use for reversal, when I'd like to give it, and so forth. So I really get a lot more independence in terms of decision making, but obviously with a safety net right there to make sure that I'm on the right track. One of the other highlights that's been very personally rewarding has been helping relax patients who are very nervous about their upcoming surgery. So part of the way that I do that is just talking with the patient and reassuring them, answering any questions that they have before they go in for their surgery. Dr. Feinstein, I'm really scared about this surgery. I legitimately haven't been able to sleep or think about anything else in the last 5 days. Don't worry, Mr. Patient. I'm gonna be there for the whole surgery, taking care of you while you're asleep. But then the other part of it is giving them 1 milligram or 2 milligrams of Versed, which can really help relax them. And also, I've got this medication here that's gonna help you feel nice and relaxed. Shoop, shoop, shoop. Bro Feinstein, that gold chain you got on is sick as Other highlights include doing awesome procedures. I mentioned I did a nasal fiber optic intubation for the first time, which was really enjoyable to do. I also did a number of different nerve blocks, including a subcostal block, an ilioinguinal block for abdominal surgeries. And then of course placing IVs, doing intubations. All of these are commonly done procedures in anesthesia, and it's been great being able to do them. A couple last highlights are things that I just really don't miss about my intern year. The first one is the lack of rounding. I really don't miss walking around for 4 to 5 hours at a time when I've got a to-do list with 40 items on it and I'm unable to do them because I'm on rounds. And the last thing that I really don't miss about being an intern is the physical or emotional dependence on my multicolored pen. Peace! I'll break challenges down into 2 main categories. One is book knowledge and the other is practical knowledge. In terms of book knowledge, there's just so much to learn. I'll use drugs as an example. So for drugs, you have to learn things like the mechanism of action, indications, contraindications, side effects, allergies, duration of action, and lots of other aspects of the drug. Then the other category of clinical knowledge is the kind of stuff that you wouldn't necessarily get reading from a textbook. So that might be how to use the particular ventilator that's in your operating room, or the ins and outs of your monitoring equipment, or just the overall flow for how the operating room goes in case of start and finishes, and then how you need to do your charting. The last challenge is a little bit embarrassing to mention, but I do have to say that my left arm is actually fairly sore. At baseline, I'm already pretty out of shape, and especially after COVID, I haven't been going to the gym for months. But then after a week of doing direct laryngoscopy where I'm lifting people's heads using my hand, it's actually pretty sore. I'm a little ashamed to admit it, but I'm just putting it out there. The last thing I want to talk about is studying, because this is also a really big component of being a resident. At the end of the day, when I get home from the hospital and after I've looked up my patients and talked with my attending about what my anesthetic plan is, then I also have to spend time reading. I personally use what's referred to as Baby Miller to get started. Other people have different preferences, but for the most part, it's a lot of the same knowledge, just conveyed in different ways. The best way for me to learn is with flashcards, so I actually make flashcards of a lot of the pertinent stuff that I'm reading and then put that into an Anki deck, which I study on my phone during downtime in the hospital. Chances are you're already familiar with Anki, which has a free desktop app, but I'd highly recommend plucking down the $25 to just get the mobile app so you can take it with you on your phone. The other source of information for my Anki cards is what I've written down throughout the course of the day. So for the most part, these are clinical pearls that my preceptors told me as we've been in cases. I always just make sure to carry around a little sheet of paper so that I can write this information down and study it at the end of the day. Well, that wraps up this video, and overall it was a really exciting and also really tiring week, but I couldn't be more delighted about being in anesthesia. I'd love to hear any feedback if you want to write it in the comments below. Thanks for watching, and I'll see you next time.